Chairman, we are ready to begin.
Thank you, Denisha. Denisha, would you please call the roll?
Yes, I'll begin with Norman Boyd,
Here.
Russell Crutchfield,
Here.
Cynthia Rucker,
Here.
Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Nelva Lee,
Here.
Shane Mobley, Robert Coles,
Here.
and I'll ask the final time, Shane Mobley. Chairman, that concludes my roll call.
Thank you, Denisha, and thank you all the board members for taking the time to be with us today. And we do have a quorum, so we can conduct business. Today, on our agenda, we have basically 4 items that will be asked as the board to consider for final adoption, and a vote will be taken. And we'll move into those as consistent with the agenda. But first of all, concerning the approval of the minutes of the February 9 meeting, I asked Dr. Rucker if she's had a chance to review those minutes and can recommend approval.
Chairman Board, I have reviewed the minutes from February 9th, and I find them to be in order. So I do recommend they be approved as stand.
Do I hear a motion for a second to that?
Second, Dr. Coles.
Dr. Cole, second to that motion. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, the minutes are approved for the February 9th meeting. Thank you very much, Dr. Rucker. We'll move on to the next item. We had a audit committee meeting this morning, and I'll ask the chairman of that committee, David Cruz, if he would give us a report on the audit committee meeting. David?
Thank you, Mr. Chairman. We had 4 members present for our audit committee meeting this morning. And during that meeting, we heard reports on 2 audits, corrective action plan follow-ups. Inspector General Mrs. Sonia Allen Smith and Mr. Joe Hood, I'm sorry, gave us a report on the FY 2021 statewide single audit. And we discussed the corrective action on 6 findings from that audit. We had good discussion by our board members, and we heard good progress being made on the corrective action plan. We also heard a report on the FY 20 performance audit for Medicaid and Beach Care Managed Care Plan program integrity audit. There were 11 findings in that audit, and we heard reports in detail on progress being made addressing those findings. So board members' questions were addressed, and I think we felt good about what we heard from department staff as far as progress on those 2 audits, Mr. Chairman.
Thank you, David. Are there any questions from the board or comments regarding the audit committee meeting? Hearing none, thank you very much. And we'll move to the next item on the agenda, which is the commissioner's report.
Good morning, Mr. Chairman and members of the board. Thank you for being here today with us. I'll keep my comments pretty brief. March is off to a fast pace. We're starting to rock and roll through session. It started a little slow, but we're in full swing now. The House recommendation on the FY24 budget came out yesterday afternoon, and we in fact have a budget hearing with the Senate this afternoon to discuss both the governor's recommended budget changes as well as the House recommended changes. We're grateful for the governor's support on a number of key items in our budget, and then the House has added a number of additional items in support of provider rates and other services that will continue to improve access to care for our Medicaid members, as well as to support the state health benefit plan, which we've talked about previously. So we're still working through some of those numbers and changes, but look forward to discussing them across the street later this afternoon. And of course, we'll share final updates with you next month. Speaking of next month, this may be our last board meeting in this building location. We are scheduled to move to our new office home that we are so grateful for, likely shortly after spring break during the middle of April. And so teams are packing and planning and working through all the logistics from everything from physical files and office materials to setting up our new technology and infrastructure over there. And so we look forward to being there with you all and hosting you there, hopefully in the coming few months to see that new space. There are 4 items on the agenda today for final adoption. There is one item that the board initially adopted in January that is not on the agenda for today. That was a proposed amendment to hospital permit requirements that would increase the notification on a closure or material change of service to 180 days. We did receive several written comments and public feedback during our public comment period. And we'd like to just to take a little bit of time to engage in some further dialogue with those constituents and members of the community that submitted comments before we bring that item back to the board for final action. So we'll continue to work on that and follow up with the board potentially next month if we get to a good spot, but we'll certainly keep you posted. Happy to answer any questions, Mr. Chair, but that concludes my update for today.
Any questions, comments from the board, please, for the commissioner? Hearing none, we will move on to our agenda items. As we said, there are 4 items here to consider for final adoption. All the presentation on all 4 will be made by Joseph Hood, our Chief Operating Officer. So, Joe, I will turn it over to you.
Thank you, sir. Good morning, Mr. Chairman, Commissioner, board members. Our first item for consideration is a change to the nursing home rules and regulations. Today, the department is bringing forth recommended changes in the nursing home rules and regulations contained in 111-8-56 to incorporate new notice requirements to the department for final adoption. This is an amendment to an existing rule updating nursing home permit requirements. The amendment requires the applicable parties of nursing homes to provide at least 90 days prior written notice of a proposed transfer of ownership or operator, anticipated closures or interruption of operations, certain nursing home transactions, and material changes of nursing home operations. The amendment sets forth penalties for failure to provide such notice. Additionally, the amendment specifies explicitly when the nursing home permit must be surrendered to the department. There was an opportunity for public comment at a Zoom meeting for public hearing on the proposed changes on February 1st of 2023 at 11 a.m. Additionally, written comments were accepted by the department through February 8th of 2023. There were no comments received. I'm happy to answer any questions from the board, but if there are none, we request favorable adoption.
Questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Roger Folsom, motion for final adoption, Mr. Chairman.
Yeah, Roger Folsom has made the motion for final adoption. Is there a second?
Russell Crutchfield, second.
Russell Crutchfield has seconded that. All in favor, say aye.
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 Opposed? Opposed? Abstaining? Hearing none, it is approved. Joe, thank you very much. You may move on.
Thank you, Mr. Chairman. The next proposal is a petition for rule changes or the establishment of new rules. The department is bringing forth a new rule in 111-1-1 for final adoption to establish a formal administrative procedure for review and consideration of a petition for promulgation, amendment, or repeal of rules made by an interested person pursuant to Official Code of Georgia 50-13-19. There was an opportunity for public comment at a Zoom meeting for a public hearing on the proposed rule on February 8th at 11 a.m. Additional written comments were received by the department through February 15th of 2023. There were no comments received. I'm happy to answer any questions, Mr. Chairman, but if there are none, I ask favorable consideration for final adoption.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Russell
Motion
Crutchfield.
for approval.
Yeah, Russell Crutchfield has made the motion for final adoption. Is there a second?
Cynthia Rucker.
Dr. Rucker has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Joe, you may move on.
Thank you, Mr. Chairman. The next item is a rule change for end-stage renal disease or dialysis facilities. The department is bringing forth a rule change for final adoption for Administrative Rule 111-8-22. The amendment to the rule will change the nursing requirement ratio from a requirement of 1 nurse to every 10 patients to a requirement of 1 nurse to every 12 patients. This has been the ratio that's been waived during the pandemic to this point. There was an opportunity for public comment in a Zoom meeting for public hearing on February 15th at 11 a.m. Additionally, written comments were received by the department through February 22nd, 2023. We received 2 comments. They were both from the 2 predominant providers of dialysis facilities within the state. The first was DaVita, which has 2,470 Georgia-based employees and serves over 9,000 Georgia patients. And the second is from Fresenius Medical Care, which has 1,600 Georgia-based employees and serves over 7,000 Georgia patients. Both companies acknowledged that staffing shortages were adversely impacting their industry, and they fully support the proposed rule change, which they state will positively impact their ability to provide safe and high-quality care in the state of Georgia. I'm happy to answer any questions, but if there are none, the department requests favorable final adoption of this rule.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Shane Mobley, I motion to approve.
Shane Mobley has made the motion for approval. Is there a second?
Second, Dr. Coles.
Dr. Coles has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Joe. Always good to get the positive feedback from the primary providers there. I think that's
Absolutely.
that was a good note.
Thank you, Mr. Chairman.
Thank you. You may move on.
The last item that I have, Mr. Chairman, is the repeal of a regulation for patients' right to independent review from 111-2-3 for final adoption. The department is requesting a final adoption of the repeal in its entirety, the rule of the Department of Community Health Planning Patients' Right to Independent Review contained in 111-2-3. The proposed rule is requested to be repealed due to the passage of House Bill 1013 in 2022, which transferred the oversight of these provisions from the Department of Community Health to the Office of the Commissioner of Insurance Fire Safety, effective July 1st, 2022. There was an opportunity for public comment in a Zoom meeting for public hearing on this proposed change on January 25th at 11 a.m. Additionally, the department received written comments through February 1st, 2023. There was one comment that was received, but the contents of the comment were not materially related to the proposed rule or its purpose. Therefore, I'm happy to answer any questions, Mr. Chairman, but if there are none, I request favorable final adoption of the repeal of this rule.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for final adoption?
Motion for approval, David Cruz.
David Cruz made the motion for approval. Is there a second?
Second, Roger Folsom.
Roger Folsom has seconded that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Thank you, Joe,
Thank you, sir.
very much. As usual, we move through that agenda, and we did have, and we thank the department for all the materials that you worked on and provided for us as background so that we as board members could review that ahead of the meeting. And that is always appreciated, and Denisha always gets those to us, or has been, with a track record of about a week in advance. So having that time to do that is much appreciated. Does anyone in the board know of any new business that needs to come before the board at this time? Hearing none, I thank you for your participation today. We had 100% participation, and thank you very much for your time, and you all have a good day. Goodbye. Meeting is adjourned.